Join me as I take on the challenge of treating your sciatica pain with these top 5 tips. These are the things that I recommend everybody do, especially if you are having a recent onset of sciatica. Now, a chronic sciatica that's been going on for months, these tips will still be helpful, but definitely if you are having sciatica that just started within the past 24 to 72 hours, these tips are going to be crucial to getting you on the road to recovery. So many people have reached out to me and said that they had a recent onset of sciatica symptoms or their symptoms have flared and they've been watching videos and they're not sure what to do. Maybe they've tried some of the things from the other videos and they feel like it actually potentially increased their symptoms. So this video today is focused on the things that you can do right now that will be safe to decrease your symptoms, because there's exercises and stretches and stuff that you can do maybe in the long term, but when you're having a recent onset of sciatica symptoms, these are the things that you want to be doing to get those symptoms to be decreased. Because when it's all flared up and everything's hot, it's just really difficult to figure out what's helping and what's not. Now, the first thing I'm going to recommend, many people think is controversial, however, I'm just speaking the truth here. You need to be icing for 5 minutes every hour when you're having that hot sciatica pain. Now, a lot of people will ask me, where do I put the ice? First, you want to put the ice where the pain is, because that's going to help decrease your pain and allow you to move on to step number 2, which may mean that you need to use the ice to chase the pain. So some people, their sciatica pain starts in their low back, it goes into their hip, it goes down the back of their leg. Go ahead and use the ice for 5 minutes on your low back, 5 minutes on your hip, 5 minutes down the back of your leg. The goal is to get the pain decreased enough that you can move on to step number 2. So you may have to chase it with ice, and there's nothing wrong with that. Icing for 5 minutes only decreases the pain for a short period of time, and that's why I want you to do it every hour, because we want to keep that inflammation down overall so that you can do the other things that are going to be helpful in relieving your symptoms. Which is important because a lot of people are wondering, will icing actually help my sciatica? And the truth of the matter is the icing will decrease the pain that will allow you to do the other things that will actually heal your sciatica. I understand that ice is a Band-Aid technique and it doesn't decrease your pain forever. However, when you're having an acute sciatica flare-up, you need every single Band-Aid you can get. So, grab your ice pack, start icing for 5 minutes every hour, get your pain down, and let's move on to step number 2. You want to keep moving as much as you can. Now, this is, again, super controversial because people are like, everything I do hurts. And I understand that. You want to find some gentle motions that you can do that are pain-free. And to start with, that may be walking laps around your kitchen or walking around your house. It's not necessarily going to be huge motions. I'm not asking you to do jumping jacks or go for a run. I'm asking you to move around gently as much as you can. For a lot of people, starting off just walking a couple laps around their kitchen counter is very, very helpful. And then they sit down and they use the ice again to help to decrease the pain overall. Now, you may feel like this is not enough movement to actually make a difference. So I want to share with you a story of one of my subscribers who actually had an acute onset of sciatica, watched a bunch of my videos, and we ended up doing an online health coaching appointment. And it was so fantastic because during the appointment, she told me, I tried the ice for 5 minutes every hour, and then I just tried walking around the kitchen. And I did not think that that was going to help with my sciatica symptoms, but man, it really, really did. So by the time we had the online health coaching appointment, she was ready to move on to the next step. And we were able to help her determine what the next best step was for her. So step number 2 is keep moving as much as you can without increasing your pain. This will be short bursts initially, and then you want to try to stretch it out. Now, once you start having that pain come back, grab that ice pack and have a seat. Which moves us on to step number 3. You want to ensure that you have proper posture while you're sitting, because it's really important to make sure that you're not overloading that sciatic nerve while you're sitting. So proper posture while you're sitting is your head above your shoulders above your hips. Now I understand that this can be really hard to maintain when you're in a more comfortable chair or on the couch, which may be your preferred place to sit right now. So I'm going to encourage you to use some pillows either behind your back to help maintain your spinal alignment, or put a pillow underneath your knees to take some of your stress off of your sciatic nerve. But you want to make sure that you're ensuring that proper posture of your body while you're in that sitting position and resting. One thing that might be helpful is to take like a bath towel and roll it up and put it behind your low back. That can help to increase your lumbar arch, which can make things a little bit more comfortable, especially if you're sitting on a softer surface. Now, many people have asked me, should I be sitting on the couch or should I be sitting on a firmer chair? And actually, I've even had some people reach out and be like, why is it that I don't have sciatica while I'm on a firmer chair, but I do have sciatica while I'm sitting on the couch? And the truth of the matter is, in a soft or cushy chair or on a couch or a recliner or something like that, it's more difficult to maintain that proper posture. That's why you're more likely to have symptoms. Plus, it's also harder to get off that surface. So if you're in a recliner or on the couch, my couch is really deep, so trying to kind of scoot forward to get up from that couch can be really painful if you have sciatica type symptoms. You may find for right now that sitting on some firm surface like a kitchen chair is going to be more comfortable for you with your sciatica symptoms. But I will say, when everything's flared up, find your position of comfort. If it's a firm chair, if it's a recliner with pillows, find a position that relieves some of the pain so you can get a little bit of a break while you're icing, because that's going to empower you to be able to move more. If you're getting value out of this content, I'm going to encourage you to click that like button and even share it with a friend who's suffering with sciatica symptoms. Now, tip number 4, although we just talked about sitting and we want to make sure we maintain proper sitting, we don't want to sit for long periods of time. So we want to avoid sitting for more than an hour. The reason why is that inflammation can kind of congeal and sit in one place, which can really irritate that sciatic nerve. So it's important to make sure that we're getting up and moving regularly. Now, obviously, most people do sit while they're icing, and that's fine for 5 to 15 minutes if you're icing different areas. And then you want to get up, you want to move around gently, not increasing your pain, but you want to make sure that you're not sitting for more than an hour. And again, this is a critical point, and it may seem like not that big of a deal. However, you will notice that the more frequently you get up, eventually those muscles will start kicking in more, and you'll have less pain as you're trying to get out of bed. I have also had many people contact me who will go to bed for multiple days in a row, and then every time they get out of bed, because they've been in bed for multiple hours, it's excruciatingly painful. And I know it sounds counterintuitive, but the best answer for this is to get up more regularly. You see, what happens is when you're sitting in a position for a long period of time, that inflammation really can bathe that sciatic nerve and really get irritated. So you want to make sure either that you're changing positions, you're getting up and walking, or you're doing some gentle motion regularly while you're sitting or lying down. The one caveat to that is please do not hear that as get up every hour all night long. When you're sleeping is when you're healing. So when you're sleeping, sleep for as long as you can, because it's really important for the body to have the time to heal. You don't have to get up every hour while you're sleeping just because you want to be moving regularly. That would be the caveat, that I want you to get a good night's sleep for as long as you can, because that's really going to help your body heal in the long term. Just remember, when you get up from sleeping, everything's kind of congealed and it's going to be bathing that sciatic nerve. So definitely get up very carefully so that your symptoms don't flare up in a huge way. Because that's tip number 5, is to make sure that you're getting enough sleep. It is critically important that when you are dealing with something like a sciatica or really any kind of issue that's causing pain and dysfunction, you really need to get a good night's sleep. And trying to get by on 5 or 6 hours may not be enough time for your body to heal. We really want that body to have that time to get into that REM sleep, which is when everything comes out and does all of that healing and helps our bodies feel better in the long term. So make sure you're not skipping on your sleeping while you have sciatica type symptoms. In fact, this is so important that I did an entire video on the best sleeping positions with sciatica. So we're going to link that here for you to go check out, because it's very important to make sure that you have a good sleeping position so that your pain doesn't wake you up when you're suffering with sciatica. All right, so there it is, the controversial but very simple tips that will help you get through if you have sciatica, especially if you have an acute flare-up. But if you've been struggling for a long period of time and you've been doing all the things that are contrary to this video, then I'm gonna recommend you go ahead and try these tips. You wanna make sure that you're icing for 5 minutes every hour, moving regularly throughout the day, ensure your proper posture while you're sitting, avoid sitting for more than an hour at a time, and get enough sleep so your body has time to heal. Now, if you need help finding that correct position for sleeping with sciatica, I'm going to have you jump over to that video to watch that now, because again, when you're sleeping is when you're healing. And if you are a physical therapist located in the Maple Valley, Washington area, and you love the idea of helping to educate people on how to manage their pain, we are looking to hire a physical therapist to help in our clinic in Maple Valley, Washington, and we would love to talk to you. Feel free to reach out to Dr. Amy at PT4, that's the number 4, eb.com.